What do we do? No, 3:30. We have some chapters that I need to go over, and also I want to go over the Hesse study stuff. Well, I'm recording. I am recording it. Yeah, I know. So make sure I've got plenty of charge on my laptop as well. So did you like that about Wilma? Yeah? Yeah. So remember, just because you might not be doing one of these sheets, right? Doesn't mean that you can't go to the top, right? So that's my thoughts on that. You can start out as she did. And become a gold medal. Exactly. That's what I actually what is 25? Hopeful. Okay, I'm miles away from there, so I actually prefer to be down that end because it's a little bit more space, but I'm sorry guys, I have to be here near the laptop or bring it. So, all right, so chapters 45, 46, and I think 48, something like that. Yeah, I think it's 45, 46, yeah, and 48. And I'm really not going to spend long on this, I promise. I want to spend like half an hour going over these chapters very quickly, and I want to spend an hour going over Hesse prep. Okay, so hang with me. But I do need to go over these a little bit, just because I need you to understand chapters 45 and 46, what we're looking at a little bit. So chapters 45 and 46, what they're talking about is anti-neoplastic medications. So we're looking at forms of chemotherapy predominantly. Zofran is an antiemetic that you would give before it, yes. So what happens with these chemo drugs, a lot of the time you're either giving it at what's called a cell cycle specific component or a non-cell cycle specific. So these drugs are formulated in many different ways to either hit the cancer cells where it's going to be most vulnerable, which would be cell cycle specific, or they're just going to blast them. They're just going to try and blast them, okay? Normally you get a combination of maybe a cell cycle specific one and a non-cell cycle specific to try and hit at different times, right? The problem is with chemo drugs, and I'm not really going to go into specific chemo drugs because you're not going to get tested on them, all right? What you are going to get tested on are some of the adverse effects of chemotherapy. So if we turn to page 700, you can see, obviously, there are a lot of adverse effects to chemo. Can you guys hear me all right? Can you hear me? Maybe, maybe not. I'm going to move from here. I'm hiding behind here and I don't need to. Sorry. I'm moving. I'm going to go here. All right. So can you guys hear me? Hopefully. Yeah.
Yes, ma'am.
Okay, cool. So adverse effects of chemotherapy. What do you think? Has anybody ever looked after anybody who's had chemo? Yeah? So what types of adverse effects might there be?
Hearing loss, nausea,
Nausea and vomiting and diarrhea. Yeah.
fatigue, Extreme fatigue, is that an adverse effect or just a side effect?
Which one?
Extreme fatigue.
Fatigue, absolutely. But let's look at some of the biggies that happen. So let's think about this. What we're doing is wiping out, or hopefully wiping out, either a solid tumor or it'll be, say, leukemia or something of that nature, right? So we're doing one of those two things, either a solid tumor or something like leukemia, and we need to ablate these cancer cells one way or another. The problem is we also end up hurting the healthy cells as well, don't we? So then we get things like what is called myelosuppression. We're suppressing the bone marrow. So what happens in the bone marrow is you've got all of our cells, right? You've got our white cells being produced, our red cells being produced. So unfortunately, if we're suppressing the bone marrow and we are ablating these cells, people's white cell count's going to go down, aren't they? So they can become what's called neutropenic, low white cell count, right? That's one of the big issues. One of the things I want you to be aware of is this term nadir, N-A-D-I-R, nadir. What happens is you give chemotherapy, and about 12 to 14 days after chemo, a patient will hit their nadir, and that's the lowest point of the white cell count. Do you think they might be susceptible to infection at that point?
Yes.
Yes. So that's one of the big teaching pieces, right? Another big issue is, and this is a huge one, extravasation. And I've mentioned extravasation before. When we give chemo, it's pretty darn toxic, isn't it? Right? So you think about this toxic solution going into their veins. Unfortunately, if the needle comes out of the vein, right, or if the cannula comes out of the vein, do you think that could cause a problem to the skin?
Mm-hmm.
Yeah.
Are chemotherapy, like, are there needles, like, the size of, like, if people donate plasma, are they the bigger needles or are they smaller needles?
It depends on what's going on. That's a good point, Ariel. So a lot of the times people will have ports and lines put in so that they can tolerate chemo, because after a while the veins just become really hardened, and it's difficult to keep getting IVs in there. So they'll end up with, say, a triple lumen catheter or a port or something like that, or a Hickman line, which is a wide bore, so that we can give, because often we're giving a lot of blood and chemo. They need a lot of lines. So it's a good point. But I want you to be aware of the fact that extravasation is one of those huge pieces that we as nurses want to be aware of, right? Always checking that IV site, hourly rounding, checking that IV site, making sure that it hasn't infiltrated and that the patient won't end up with what's called necrosis, because that's potentially what can happen around there in the tissue. All right, we call the nadir, or absolute neutrophil count, is when it's less than 500, and that's on page 702. That is severe neutropenia. Okay, so far we're looking at myelosuppression, extravasation, nausea and vomiting. Okay, those are some of the big issues that are going on with these patients. On page 704, it shows you a breakdown of all of the toxicities for anti-neoplastic medications. Pretty much everything. I mean, you know, pretty much. Yeah, from GI to cardiovascular to on and on and on. And as I say, I don't necessarily feel that you need to know the different types of chemotherapy as it's today, because you're not going to get tested on chemotherapy. What you might get tested on is the side effects of chemo, which I've just mentioned a few, all right? Couple of other things I want to mention to you. Let's focus on page 709. 709. Look at some of the symptoms. I'm sorry, 7010, 709, 7010. So things like altered mucosa. Altered mucosa. A lot of patients get what's called stomatitis. It's one of the big issues, stomatitis. They can get candida in their mouths, things of that nature. It says impaired oral mucosa on page 710. And then, of course, we mentioned nausea, vomiting, diarrhea, all of those types of things.
That's what bullet point? The first one.
All of these bullet points I'm just pointing out to you. What about alopecia? What's alopecia? Hair loss. Yeah. Again, bone marrow suppression. And that nadir. And looking at what's called the absolute neutrophil count. That's one of the big concerns. Making sure the patient is protected from infection. So they're going to be on what is called neutropenic precautions, okay? So they can't have flowers in their room, fresh flowers, no fruits, nothing like that. Anything that could be a risk that's going to bring in infection into their room.
So,
Yeah.
Which patients can a nurse have if she has a neutropenic patient? Can she only just have that patient?
I would not want to put a neutropenic, I would not want to put a nurse with a neutropenic patient and somebody who has a severe infection. I would not put those two things together.
So C. diff, neutropenic.
I would not do that.
Okay.
If I was charge nurse or manager, I would not do that. I would try and make sure that that nurse doesn't have infected patients, okay?
So it has to be a patient with maybe hypertension or something?
Yeah, med-surg,
Okay.
but not infections. That would be, if I was a charge nurse, I would try and make sure that that would be. Some of the other issues, sterility. So we need to make sure that if possible, when the patient starts chemotherapy, that of course they're aware of those potentials, but you know, if they do want to have children, that maybe they're able to store their eggs or their sperm or something like that, okay? All right. And again, you're going to check that IV site every hour for redness, swelling, heat, and pain. I want you to be aware of your CBC ranges, right? Your red cell counts, your hematocrit, your hemoglobin, and your platelet, and your white cell count. You need to know those lab values. On the white cell count?
Is it for male and female? The one says male, the M stands for male?
Male, yeah, males are slightly different to females because females, their hematocrit is going to be less normally because of the periods, because of their cycling.
So you want us to know for both male and female?
Yeah.
Okay.
I mean, I don't want you to get hung up on it. I don't think you're going to get an exam question on it, I promise you. Certainly you're not going to get any more exams from me, and I don't think you're going to get an exam question on the HESI about it. But I just want you to be aware of these ranges, all right? Because obviously as their hemoglobin and hematocrit goes down, right? What do you think that does to the oxygen capacity of the person?
Goes down.
So we have to think about this. Is why a lot of time they need packed red blood cells, right? The other issue is platelets. Their platelet counts go down. So what do you think could be a risk there? Bleeding, exactly. Yeah, it is a lot. Hem-onc nursing is not for the faint-hearted.
So these are all adverse effects, right?
Yes,
Okay.
these are all adverse effects. It is, yes, these patients go through an awful lot, that is for sure. So look at some of the things that we can potentially do to make things better for them, right? By the way, neurological functioning as well. A lot of these meds can cause things like neurological changes, but also things like what? Neuropathy, thank you. Peripheral neuropathies. A lot of these meds can cause that, okay?
Ms. Fletcher, you on 712?
I am. You're doing great. Yeah, I know I'm zipping through this. So teaching and care of these patients, care of the stomatitis, you're going to use things like a soft toothbrush, warm fluids, not harsh fluids, no alcohol type of rinses. You know what I'm saying? No mouth rinses that have got alcohol on. This is all on page 713. You want to make sure that, because what can happen is with low platelets, they can have bleeding gums, right? So this is why you want to use gentle mouth care, but at the same time, they do need a lot of mouth care as well. All right.
Warm water, right?
Yeah, yeah, I would say, I mean, they can use cold water, but I'm just, things that are not harsh. Certainly not any alcohol type of products, okay? Making sure we address fear and anxiety, nutrition, protein, of course, nausea and vomiting. And it talks about some of the foods that might be helpful, sipping on things like ginger tea, ginger ale, right? Like I said, carbonated. It says that it's lost its carbonation, but actually the carbonation often helps. So I don't know why they would say that. Antiemetics, you're always going to give antiemetics before chemo. Remember we talked about things like Kytril and Zofran, didn't we?
You said
Don't you give it 30 to 60 minutes before?
Yes. Yeah.
That was on the test.
Yes. So, and often we'll combine different things as well. It might be a combination of some Decadron, Benadryl, and something like Zofran. It'll be a combination of those. They might need pain medications, right? And antidiarrheals. It mentions a couple of them here, like ones with opioids in them, Lomotil, those types of things, loperamide. Okay. We talked about hair loss. And then, of course, if you scroll down to 714, down at the bottom there, anemia is a big deal. Anemia. By the way, when you give blood, it's always only ever with what fluid?
Normal saline.
Normal saline.
That was the question.
All of you that put dextrose or anything else, it's normal saline. Oops, just gave it to him.
Well.
Oh, well. Oh, they get a freebie. All right. Let's see. Neutropenia, thrombocytopenia. I just mentioned to you, neutropenia is the white cells, right? And thrombocytopenia are the platelets. Now, the reason I'm bringing this out is because on the HESI, and this is why this is actually leading up to the big finale here. Pretend you're at a concert. This is the finale. All right, so filagastrum and epigen. Do you think they play a big part in chemo and oncology? Yes. Filagastrum helps increase what? It's called Neupogen. That's your clue. Neupogen, white cells. Okay, so remember the other day I talked about these medications that are given subcutaneously. Anybody remember? Maybe a little bit? I mentioned that there are going to be 2 meds that probably are going to be on the HESI. They are subcutaneous One of them is filagastrum, which is Neupogen, which helps to increase the white cell count for these neutropenic patients. Okay, that's one. The other one is Epogen, Epoetin. What do you think that might increase? Red blood cells. So we use that for chemo, but you're not necessarily going to see that as a chemo question. You might see it as a end-stage renal disease patient because these patients are not making Epogen. All right?
Where are these medicines at?
I'm just letting you know because I'm going to tell you in a few minutes. Okay. So on page 752 is where Neupogen is, or GCSF.
What page?
752.
Yeah,
That's in another spot.
well, that's why I'm flipping around a lot.
We gotta trust her, y'all. Trust the process. She been,
I would agree.
Yeah.
After my first exam, I was on
right, she been getting us through all of it.
second and third.
752 and 738. 738 is another area where GCSF, filagastrum, Neupogen, all the same thing. Basically, they increase the white cell count. That's what it does. You found it? Probably. I was looking at it earlier. 7.
Filagastrum is on 738.
Yep, 738.
On the drug profile.
There you go. I think it's in 752 as well. It's in a few different places, but
Which one?
Where are we looking for?
filagastrum. I just want you to understand what this drug is because it's always on the HESI. All right? It's always on the HESI. Okay, let me put you guys here. The other one, Epoetin, which increases the red blood cells. Okay?
And what is called leucometin?
Epoetin,
Epoetin.
Epoetin, Epoetin alpha. It's on page 736 and it's on page 845. It's on other pages as well, but again,
It's on our list, right?
it is on the list.
Okay, so I'll just look it up.
Yeah.
What was the medicine on 736?
Epoetin alpha. If you look on page 736, it's actually chapter 47.
Oh.
Epoetic drugs. Filagastrum is there. And also Epoetin in these green boxes. This green box.
On 737.
Yeah. It's in the green box.
What was that, 8-something page?
845.
845. But basically, Epoetin alpha is it's derived from the hormone that I can't pronounce, erythropoietin. It's produced by the kidneys. It's produced by the kidneys. So think about this: if the kidneys aren't functioning, hey, at least I'm honest, right? If I can't pronounce something, I'll say. No, I did say it, right? I made myself do it. So if the kidneys aren't functioning well, then obviously that is not going to be produced. So these kidney patients also are patients that need this Epoetin alpha, all right, along with chemo patients. But, and as I say, I think on the HESI it focuses more on the kidney function patients or other chronic kidney disease rather than the oncology patient. Again, it talks about what is called GCSF, Neupogen, filagastrum, same thing. Basically, it's going to help upregulate the white cell count, all right? And on page 738, there's a whole little thing about filagastrin, Neupogen. So I'm just letting you know that as I go through this. All right, so where am I now? To
15.
46, chapter 46.
Oh, we went to 46 now?
Yeah, I'm done with 45. I'm done with 46. I told you I want to get through this fairly quickly so I can focus on the.
Testing. Well, you gotta worry about this. Are you're recording the thing?
I'm recording it. Yeah. So chapter 46. What I would suggest you do at the end of these chapters, make sure you look at the patient teaching, okay? Because it just goes into detail about what I talked about in literally 5 minutes, but it's talking about making sure you tell your patient to watch for things like bruising and bleeding, right? Low platelets. If their nadir is occurring or if their white cell count is getting low, they are more susceptible to infections, right? Stay away from people that might have infections. They may have to isolate, those types of things. Discussing contraception, discussing sperm banking, egg banking, all of those types of things are necessary. So there's a lot of different things that are to do with education and teaching for these oncology patients. So I would strongly suggest at the bottom of page 45, at the end of chapter 45, that you look at these things. Because these patients are susceptible to everything. All right, chapter 46. I want you to look on page 722. 722. It talks about extravasation. Bless you. It's a big deal, extravasation. Believe me, I know. It really sucks when it happens and you're the nurse and you've got a patient that it's happened to. So I know this one. By the way, look at what it's saying, some of the things that you could do with these antidotes. There's different types of antidotes. Some of them are called Y-days. You're not necessarily going to need to know the antidotes, but you are going to need to know that you manage the care of this patient hourly, all right? That these patients are looked at hourly, looking at their IV sites, all of those things, okay? Looking for any redness and swelling, pain, anything like that. Burning, stinging, leakage. And when it happens, it's a really big deal. Yes. Oh. Wait. I don't understand. Okay. Well, she was here.
Who?
Oh, she left. That's right. Okay. 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 Let's go. Let me just, that threw me for a loop a second. By the way, on page 729, it gives the white cell counts that you need to know. And basically the nadir or the absolute neutrophil count is anything less below 500, which you're probably not going to need to know that. But what I do want you to be aware of, really for these types of patients, are the side effects. All right, the side effects. Some of these, and I really don't think you're going to get a question specifically on a type of chemotherapy and their side effect, meaning, for instance, some of these drugs like doxorubicin is one. let me just see, doxorubicin. Doxorubicin is bright red and it causes cardiomyopathy. I just don't think you're going to get those types of questions. It's more about you understanding the care of the patient and the side effects of these meds and how to care for them. Does that make sense?
So, understanding the side effects and how to care for the patient?
Yes. My suggestion, and the big ones, are understanding Neupogen and Epogen. Neupogen and Epogen, and the side effects, like I mentioned to you, low white cell count, low red cell count, platelets, alopecia, nausea and vomiting, all of those, stomatitis, all of those types of things. Okay. You got it go?
Yes.
The things up there for you. All right. So that's chapter 46. And as I say, I'm sort of skimming over them a little bit. And on page 729 at the bottom there are the lab values to do with the white cell count, just so you know. And once again, patient teaching care on page 730. Be aware these patients need to drink lots of fluids. Sometimes we try and push up to 3 liters of fluid a day to really clear out these metabolites, really clear the system of toxins, okay, and prevent dehydration.
3 liters a day?
Up to 3 liters a day, yeah, depending on what type of chemo we're giving.
That be in addition to whatever they would intake normally?
No, that would be a total,
Okay.
like 3 liters. I think any more than that would be a lot, but definitely trying to push that amount of fluid. Remember I talked about bladder irrigation? Yeah. So again, you're not going to get a question on this, but this is to help you understand. There's a drug medication called cyclophosphamide, Cytoxan, and this particular drug causes hemorrhage, basically bleeding in the bladder. Okay, it causes what's called. Has anybody ever had cystitis? No? A UTI? You ever had a UTI? All right. So imagine it's called hemorrhagic cystitis. So these patients their bladder is bleeding. So sometimes we will do these forms of irrigation, all right? So they might have a bladder irrigation. That's where bladder irrigation, you might see it. The stuff goes in, it irrigates the bladder to try and heal it and soothe it, and then it comes out.
What
Does that make
causes
sense?
that?
What?
For somebody's bladder to bleed?
Well, yeah, chemo is,
Oh, chemo causes all this.
mustard gas that was used in World War I. Anybody ever heard of mustard gas?
No, ma'am.
Yeah, well, it's an alkylator, and basically that's a form of chemotherapy.
Oh, yeah, that was on.
There are lots of different drugs that have been carcinogenic in some way that we've actually ended up using as chemotherapy. Lots of plants, by the way, end up being used as chemo. Taxotere is one that's come from a form of yew, the yew tree. So it's a very interesting field. It's just, you don't really need to know too much about it right now. So I'm trying to save you a bit of time, that's all. I don't think you even need to know about glucagon, folic acid. No, we don't need to know about that. All right, let me move on to, is it chapter 47?
Yeah, does folic acid increase your chance of getting pregnant? I keep hearing that name.
Well, folic acid, but if you want to get pregnant, here's the thing, you need to take folic acid. If you're thinking about getting pregnant, or if you are pregnant, you need to take folic acid because a deficiency in folic acid can affect the neural tubes as the child is being formed in the womb. And so you could have deformities, I want to say that's spina bifida, things like that. So you are supposed to take folic acid.
Most of the prenatal vitamins
Have
have
folic
folic
acid.
And how many units of vitamin D did you say the other day? Was it 4,000?
5,000.
5?
5.
Oh, I went and bought some, but mine says 2,000 units per.
That's
So
what
just
we-
take 2?
Yeah, take 2,
Okay.
that's fine.
Alright.
That's good, yeah. But folic acid, we don't actually, we have to take in folic acid, all right? It's something that we have to actually take in ourselves. All right, so, chapter 48, chapter 48. This is another drug that is going to be on the HESI that I'm going over. So, 45, 46, yeah. Yeah, it's called neural tube deficits, I think, and for folic acid, and that's the issue, that you've got to take in folic acid. We don't produce it ourselves, so we have to take it in. All right, so, chapter 48, immunosuppressant drugs. Remember I said if somebody is getting an organ transplant or a bone marrow transplant, that, you know, the body is going to reject it, right? Because it's not, they're going to look at that and say, oh, well done. They're going to reject it. It's just ice, right?
Yeah.
So the body will naturally reject anything foreign in our bodies, right? So we have to give something to block that action. So what I want you to understand is an immunosuppressant drug. The one I want you to know about is cyclosporine. It's on page 757.
Thank you.
Cyclosporine. So it talks about immunosuppressants, and what it says here, it's basically blocking the T lymphocyte cell line. It prevents the body from attacking the organ. That's what it's going to do. So it prevents organ rejection, and it inactivates the T cells from producing the release of cytokines that would then try and kill that organ that's been put in the body, or the same thing if you're having a bone marrow transplant, all right? So cyclosporine, it's in this table on page 757, and I want you to know about it. Now, here are some of the teaching points, because predominantly that's what's going to be on your test on the HESI, isn't it? It's not going to ask you the fine points of cyclosporine. It's going to want to know what is it for, what I just told you, organ rejection, so you can tell your patient. Do you think your patient needs to take it every day? What do you think?
I think so.
Yes, at the same time every day. They can't not take this pill. Okay, this isn't something, some of them are going to be on it for life.
I
Cyclosporine.
think this was on the exam too, wasn't it?
It
Probably.
was on the,
This was on the
EAQ.
exam.
It's on an EAQ.
yeah, I'm looking at it right now.
Remember, it was, oh,
So they have to be taken every day. If a dose is missed, it should be taken as soon as the patient remembers. Okay?
So this is the same med for patients with tuberculosis?
Hang on, I can't hear you very well. I'm sorry. Say that again?
This cyclosporine is the same medication for the patient with tuberculosis?
No. This is for patients that have had some form of organ transplant or a bone marrow transplant, and they are taking these meds to suppress the T cells, basically attacking it.
Okay.
And they
Okay.
are, to Canada too, yeast infection. It's the white patches on the tongue. It's a-
What Oh, you're saying the adverse effects?
Yeah.
Yes. So there's a lot of adverse effects because if we're suppressing T cell, if we're suppressing the T cells, then potentially the patient unfortunately can be open to infections as well. So there's a lot of teaching on page 758. On 758, it does talk about cyclosporin. Now, to answer your question, it can be used to suppress autoimmune issues like psoriasis or rheumatoid arthritis, for instance, or irritable bowel disease. So these drugs do get used for other things, but I want you to be aware in this case of what they're being used for. Does that make sense?
Yeah.
Okay. Cyclosporin. Now, what do you think, what herb do you think might come up on the Tessie?
St. John.
St. John's wort, because it's right here. Yep, St. John's wort. Interacts with cyclosporin.
Yeah.
So make sure you're aware of that because that's the type of thing that comes up on a HESI, isn't it?
Yes.
Yeah. Yeah. St. John's wort. The other big thing with cyclosporin, and it's in this, by the way, all the interactions are on page 759 and it's a big table. But the only two I want you to be aware of is our friendly fruit juice.
Grape juice.
Thank you. Grapefruit and St. John's wort. So underlying grapefruit and St. John's wort. And by the way, do you see just above grapefruit verapamil?
Yeah.
Verapamil? Yeah. That's probably going to be in your HESI too, isn't it, Kaylin?
Right, but it's not below it.
Verapamil.
Verapamil.
And St. John's wort.
Where you see that at?
It's on that page on 759. that
Oh, I
table.
was marking in the wrong spot.
I'm looking at those.
It's the first one on the purple table. Table 48.3,
Mm-hmm,
and you see cyclosporin,
mm-hmm.
and you look at the last two.
Yeah, there's a lot of them there. All right, so here's the other pieces about cyclosporin that I need you to be aware. And again, this is on the HESI, all right? On page 760, cyclosporin, one of those drugs that we do levels on, right? Because it could be easily toxic. So we do blood levels, a trough. When do we do a trough? Before the next dose.
Wait,
Yeah.
say it again?
Before the next dose. Just before the next dose is when you do the trough. Just before the next dose is when you do the
That
trough.
was on the HESI.
Yeah.
Oh, yeah, and I was trying to think about that little discussion we had, and I was messed up.
Trough, bottom.
And then peak is,
An hour,
Yeah.
an hour after.
But usually the trough is the one that they want to know about. Cyclosporin, it comes in oral, it comes as an injection, and also be aware, as I say, lab values with cyclosporin.
Should we know the brand names?
I think they'll give that to you.
Yeah, they
did on the
They
other
do,
one.
they give you, and they tell you what the drug is for, that's what I kinda like it, they'll say, oh, this
Yeah.
drug and the generic, and say, for a patient doing something. instead of
you said
doing
oral and what else?
IV.
IV.
On page
Oh, I
762,
thought she said injection.
It would be most, you know.
on page 762, I want you to be aware of the fact that you need to also monitor liver enzymes. So it can affect the liver, right?
Yeah,
And
LFT,
kidneys.
And LFT, and bond, all of them.
Yep.
Where you at, Keith?
It's on page 762 on the right hand side.
It talks about the things that interact with it, of which I've mentioned a couple. Grapefruit will definitely be on your HESI.
Yeah.
Won't it, Monica? Won't it, Jordan? Yeah. Okay. The other thing I want you to be aware of is gingival hyperplasia. The teeth, the gums. Gingival hyperplasia. And as I say, no grapefruit, because what grapefruit will do is increase the toxicity of cyclosporin. That's what grapefruit does. So if the question asks why, it would increase the toxicity of cyclosporin.
What did you say about the liver?
You want to do liver enzymes. You want to, obviously, it can be toxic to the liver and the kidneys. One more thing. There's a lot to do with this med, I'm telling you. This is why it comes up. You can't put cyclosporine in something like this.
Cause it's gonna melt it.
It will adhere to it. Yeah. So it's one of the problems with it.
So it's basically like this.
You got to put it in a. You got to put it in a glass container. A glass container. It will adhere to styrofoam and some plastics as well. So that's a concern because they might not get the whole dose, right? Okay. So on page 763, I want you to just look at some of the teaching points. It says, do not refrigerate the oral solutions. You can mix them with different juices, other than milk and things, but not grapefruit juice. Put it in a glass container. I'm on page 763. And remember, you're going to do blood levels. So whenever you know that somebody's going to get blood levels, you know that it's got the potential for toxicity, right? And not, I mean, a lot of things do, but I'm talking about this, the therapeutic index. Okay. Immunosuppressant therapy is for life.
So they have to take cyclosporin for the rest of their life?
Correct, or a form of it. There's different types, but I'm mentioning cyclosporin.
It has to be diluted.
Not necessarily. It comes in like a liquid. You're talking about IV, I think. You're looking at the IV. Yeah. Yeah, if you're going to dilute, then you're going to dilute it in normal saline, something like that. Let's see what else I just want to mention with this. Also make sure about exposing them to the light. Okay, UV light. They could have photosensitivity. And also they could be susceptible, as somebody, I think it was Ariel mentioned, candidiasis. Who mentioned candidiasis? Me. Yeah. All right. So I'm going to be flipping through this book a little bit to give you some pieces that I want to give you as well. But let's just look again at some of these. So I've got just over half an hour, so I'll try and go through some of these things as well. Albuterol is usually on the HESI, okay? It may have been on the last one. If it was on the last one, great, but albuterol is usually on the HESI, just FYI. And while we're talking about respiratory, I did mention to you COPD, right? COPD discharge medications like ipratropium, which is a bronchodilator, or Spiriva. That's on page 572 in your books, by the way.
Thank you.
Acetylcysteine, I mentioned to you the other day about acetylcysteine, yeah? I haven't got all.
Oh, yeah, you said that aspirin is a contraindication of that.
Acetylcysteine, what do we give remember it smells like rotten eggs.
Yeah, you said that's an antidote for acetaminophen.
Thank you.
Oh, okay. Oh, yeah, that's right.
Yeah, so
Sorry,
you're going to
ACE.
evaluate whether it's working, right? Acetylcysteine. Atorvastatin, you're going to evaluate those lab values, but also you're going to evaluate the patient, you know, are they getting myopathies, anything like that. A lot of people stop taking it because of the muscle pains that they get. Okay. Actonel, actually, I'm sorry, I didn't look this one up. Actonel, it's one of the ones. Maybe somebody can look that up for me while we're.
How do you spell that?
Actonel, Actonel. It's a GI med. I think it's in your GI.
Kia, go to our messages.
Adderall, remember I said the dosage, the timing? You wouldn't, you know, if the family says, can I give this at night? That would not be a good idea, right?
Actonel is used to prevent osteoporosis and treat Paget's disease.
Okay, so that's in our women's health section. And I'm just gonna,
So the Adderall you give in the morning, right?
yes.
That's ADHD, man.
Mm-hmm.
Yeah.
So,
Where's my women's health? Okay. This is a chapter we don't really go over that much. Chapter 34 is women's health, but it's on the HESI to do with osteoporosis. And there's a few pieces. Actonel is going to be one of them. And on this little list, there's a couple of them that I want to just mention to you. Osteoporosis meds, which are biphosphonates, is another one. And then Women's Health 531. What did I say about biphosphonates, by the way? What do you how do you have to take them? Walk and talk. What does that mean, really? They have to sit up and they've got to be able to drink,
Oh, yeah.
right? And
At the
stay
30 minutes.
sitting up.
and that's for osteoporosis meds.
Correct.
Oh, you did go over this, Drew.
Yeah.
Yeah, I got it.
Alendronate, Fosamax. And under alendronate on page 533, it talks about the fact that they have to drink an 8-ounce glass of water from once they take it, and they cannot lie down for 30 minutes after taking it.
Are you still talking about the bisphosphonates?
Biphosphonate, that all of these are biphosphonates.
Oh.
There is a concern for jaw necrosis with them, but apparently people aren't that bothered about it. They're on them. But anyway, they have to sit up when they take this because it can cause gastric ulcers. Okay, so. Esophageal erosions can be caused. All right. Also on this page, another thing that's on the HESI a lot is calcitonin. Now, I don't know if it's going to be on this HESI or not. Calcitonin is on that page. It's actually a form of calcium. It's got calcitonin, sounds a bit like calcium, doesn't it? But it's derived from fish, yes. So if somebody is allergic to fish, you need to know that, right? Because potentially they can't take that. So it's derived from salmon, and it can come in a nasal spray. So I want you to be aware of that one too. And risk factors as well for patients that might need biphosphonates. Actually, people that look a bit like me, quite honestly. Thin, small, high risk for osteoporosis. So know the risk factors: smoking, alcohol, low calcium diet, sedentary, family history of osteoporosis. It's on page 531.
So we need to make drug cards for these medicines, basically.
Maybe, if that's how you like to study. Okay. So let me go over, I'm not going to go over all of these. I'm going to go over the ones that I want to hit that I feel that I haven't really hit. So if somebody can find where Actonel is, because I have to say, while I'm going over some of this stuff, that would be great. I know Billy's really good at looking up stuff. Not putting you on the spot, Billy, or anything. But, okay. All right, let's look at a couple of them as well. Kalan, adverse effects. It's a blood pressure med, right? Cardiac med, verapamil. Cyclosporin is on here, on your list. And now you've gone over it, cyclosporin, right? Epogen or epoetin alpha, chronic kidney disease. It's asking for the outcomes. So hopefully what we're looking for is a hemoglobin and hematocrit to go up, right?
What kind of drug is Actonel? What class is it?
It's a biphosphonate, apparently. But for some reason, I haven't found that. Filgrastim, you know what that is now, right? Filgrastim on this list. It's on your announcements. Shall I
Yeah,
put,
that's what I was looking at.
let me put it on your
To see how to
announcements.
spell it and stuff. Did we ever find that one word?
We're looking for it now. It's about Actonel?
Mhm.
Yeah, Actonel.
Let me put the list up for you because I put it in your announcements. Hopefully you all saw this. Did you all see this list?
Oh,
Okay.
yeah, that's wrong.
Okay. So this is your list. So the ones that I wanted you to be aware of that I hadn't had a chance to sort of talk to you about were things like cyclosporine, epoetin alpha, filgrastim. Okay. Now here's another one that I wanted to talk to you a little bit about, leukotrienes. Okay, on page 574, which is to do with your respiratory section in your book, it talks about leukotrienes.
What was the word you wanted us to look for? Alpha-boy?
Actonol.
I can't find it.
Yeah, that's
How do you even spell that?
I think I've looked for it before and I can't find it.
that's why okay, so I'm not going crazy. It's like yeah.
Actenol?
Did you find it?
It's on page 531.
531.
The word, ribosome, it's not Actonel, it's behind iodine.
It's behind what?
It's under drugs for osteoporosis. It's
Ribosome.
It's probably just one word, right?
ribosome.
Risedronate. Okay, where's
It's RICEDRONIC acid.
Where you see that at?
Oh,
Oh.
no, I was trying to see how to spell it. That's what it says in the book. It ain't gonna say acronym.
I see drugs for osteoporosis.
Does it say Actonol?
No.
Oh,
What does it say?
Mercedes? Oh, RICE.
Is that where it says Antamo X? Is that what you're looking
No,
at?
it says ribosome.
Yeah, that. Oh, it's right here in,
Oh, never mind.
So I think you're just going to have to be aware that if you see that on the test, I don't know why they've even got that in the HESI. Actonol,
And it's called ribosome.
but it is a biphosphonate.
Yeah.
Where are you seeing it?
Right.
There.
The citrate. Where are you seeing? Oh, it doesn't give you the.
Oh, no.
Okay.
It's just saying,
Okay.
for osteoporosis.
So let me put that in there for you. Risedronate. Okay, I will put that in. Let me do that right now.
You give us a 3 point. Leave it in the book.
She probably would if it was her.
Yeah.
Hep C though.
In the book.
Okay, there you go, recitronate, right? Is that how it's spelled? Thank you. The bottom line is, if anything has this on the end, matronate, you're gonna know it's a biphosphonate, right? So if, whether it's a Fosamax or whatever it is, if it's something like that, then it's the same teaching, because that's what it's asking. That's the big deal, the administration of this thing. And that's why I keep saying they've got to be able to walk and talk. That will help you remember what I mean by that, right? Got to be able to sit up and drink a full glass of water, and they have to stay sitting up for 30 minutes after they've taken this to prevent erosions. Okay.
Oh, we got rise in there, like rise up.
There you go. That might help. Recitronate, rise up. That's a good one. That's a good way to remember it. All right, so leukotrienes, page, where's the?
We said 574.
574, you said.
Yes. Yeah, respiratory. So ipratropium, atropine is usually on the HESI. That's your COPD type of med, right? It's 572. But albuterol is usually on the HESI. But what I want you to be aware of with leukotrienes, see where it is, teaching about leukotrienes. So remember we talked a little bit, well, I talked a little bit about leukotrienes, just a tiny bit. And it's a way of the body trying to do a response. I don't know where I put my stuff. Where did I put my sheet? Here it is. Here it is. So when someone has an allergic reaction to, say, I don't know, cat or dust or whatever, right? It's going to set off the mast cells to release leukotrienes. They release a lot of other stuff, you know, histamine, whatever, but they release these leukotrienes. So bear in mind that people take leukotriene inhibitors, don't they? Montelukast is an example of that, right? Those Singulair, Montelukast, that type of thing. But we need to teach them to make sure they take it. That's not like your inhaler that you just take, your inhaler that you just take as needed. This is something that they need to continue taking. So part of the teaching with these leukotrienes, I don't know if they're talking about the actual allergy in the sense of making sure you stay away from things that could cause this type of allergic reaction, or whether they're asking you patient teaching regarding these leukotriene. Let me see if I can find them.
So it's a maintenance drug or preventive?
It's a preventative and maintenance,
Okay.
because they block leukotrienes. So leukotriene receptor antagonists, they block them. And they block the inflammatory process. So it is preventative and it is maintenance. That would be part of the teaching with leukotrienes. Does that make sense? And leukotriene receptor antagonists are on page 574. But the teaching is the deal that I think will be on the HESI. And it says under indications, they use for prophylaxis and long-term treatment and prevention of asthma. They're supposed to be taken once a day. They're not just for asthma, they can use them for allergic rhinitis and things like that, but
It's on 582.
582, it's also on 574, the indication of what I think it's going to be for. 582?
Yeah.
Yeah, there you go, the patient teaching, thank you. So just be aware of that, because I wouldn't be surprised if it's something like that that they're asking you, okay?
Why are we taking it at night?
I don't know. I would say during the day, as long as they take it once a day. Does it say to take at night?
It says instruct patients to take it at night.
Maybe it has more effect at night. Can't be so. There you go, start with teaching, I didn't know that. All right, let's look at a couple of other things. Topical antifungals. I wouldn't be surprised if it's going to talk about Lamisil, terbinafine, on page 661. Yes. 661, I think.
Yeah, Lamisil?
Yeah.
Yeah, 661.
So the big teaching for this, anyone have any idea what it could be?
Or which one?
Lamisil?
Making sure you're checking the liver enzymes.
Thank you. Good job. That's exactly it. Making sure you're checking liver enzymes.
For a topical?
Oh, yeah. Well, it's oral as well, but remember, it says topical antifungal, but even so, you still want to,
You also have
it's
Lamisil.
Lamisil.
Is it because for the jaundice?
So baseline renal and hepatic functions so these drugs generally can cause nephrotoxicity and hepatotoxicity. Remember, the skin is an organ, right? Even though we're doing something topical, it can still absorb. So just be aware of that.
I'm guessing I'm thinking they have to go through the mouth.
To the liver?
Yeah.
Well,
Right, so
it can still affect the liver, so just be aware.
That's turned off.
Okay. Topical antifungal. I'm trying to see if there's anything else. I would suggest you look at the patient-centered teaching on 663. Hey, you come to see me?
Well, I just came to visit, pop in and visit, if you, once you hit a point where.
Oh. Give me 5 minutes. Is that okay? Okay. Yeah. On Lamisil, you see some of the things it says to terbinafine. Part of the patient teaching might be that they got to keep that up for about 10 weeks, especially if it's a nail fungus. We talk about delightful things in here. All right. So I wouldn't be surprised if this is the sort of thing it's talking about. Over to you, Professor Davis.
Oh, is that right?
Yeah.
You gonna turn it back on?
I don't know what it is.
You gonna turn it off?
All right.
No, I don't know what it is.
Oh, this is for term 4. These are for term 4.
How's everybody?
Good, how are you?
I haven't quite finished, so are you gonna, is it?
It's
just-
one- it won't be
oh,
long.
okay, perfect, yeah.
I'll be long. I just want to introduce myself. So Professor Davis, I teach term 4. I also teach term 8, which is the capstone of the entire program. So I'm one of those people to help you kind of weave concepts together. I do believe in giving you what I call study smart strategies, right? So these things that'll be ingrained in your mind and like stick with you. Literally, when we go to clinical sites, I'm used to students pulling me aside like, do you know I still remember what you told me in class? like that's what I was going for. So what am I saying? What you don't want to do in this program, one of the great mistakes in nursing school, period, memorizing for an exam and then dump the data. Huge mistake. So what am I saying? Don't memorize, go for understanding. Memorization causes you to lose the information. Understanding makes you what? Carry it forward. And that's what I mean about the study smart strategy. how to get you to carry it forward, term over term over term, even when you get out there and you're working, you still remember, but not that you have to relearn the next term, right? Okay, so won't keep you, all right? A couple other little tips I'll say about term 4. Be prepared to have your mind open. It's happened somewhat in term 3, but not to the level that it's going to happen in term 4. Term 4, I'm used to the students say going, wait. You know what I mean? We're gonna need like a longer lunch break or something. You like, you know what I mean? You're wearing us out. Because I'm like throwing the information. It's fast. It's fast paced. So take good notes and get plenty of sleep. And by the way, use your sleep as time to study. Now that sounds crazy. As soon as I say it, it sounds crazy, doesn't it? Where you go? Some of you watch scary movies before you go to bed. And you wake up and you had a nightmare. That's right. Because Freddy Krueger was chasing you in your sleep. Right, but here's what I recommend to you. Read your nursing book before you go to bed.
Yeah, that's what we got.
If you feed your mind the right stuff, before you go to sleep, you tend to wake up with more answers,
That is true.
right?
Yeah.
Okay, somebody had the hand up.
Is there a way we can get your email?
Yeah, sure. I'll scribble it up on the board over here.
And phone number, if you don't mind.
My phone number?
Yeah, go ahead and put the number up there.
No, yeah. I'll put it up here.
Thank you.
No problem.
C. Davis at Concord.
.edu. All right. And,
Are you from Virginia?
uh-huh.
Pearl?
Yeah.
Oh,
You know,
wow.
by the way,
What
you know, you
part?
can always find out
Virginia
emails.
Beach?
Oh, that's
Yeah.
Oh, that's that.
On the front page of the thing, this is where you'll always find all about info.
Yeah, my YouTube videos, I'm at,
Somebody posted.
749.
I took a picture of it.
688.
Yeah.
When you get time, you don't have to do it right away, but.
my YouTube
No, I'm
videos
gonna do
are
a
in
block
Cliff
of
Notes.
those. You know, I got the pregnancy brain.
Click on my avatar and there's playlists and videos there that help you learn all kinds of things. Lab studies, I highly recommend the lab studies, right? That goes a long way.
How long have you been teaching term 4?
How long have I been teaching term 4? Forever.
So what's the passing rate? Just saying.
Oh, shoot. No, well, when you say term 4, I've taught it at other colleges. So
How long
as
have
far
you
as
been
term
here?
4 here, this is my second term, like a term and a half. The professor before me didn't finish out the term when I started. So this is like my first complete term of term 4
Uh-huh.
at Concord.
And how's it looking?
How's it looking?
Like, for your students passing?
I mean, they look good. They look good, but the tail, the true tail
Is that
is
heavy?
the Hesiod
Yeah.
final.
That's
All
true.
right. I mean, but my students tend to do well.
That's good.
Anyway, nice meeting you guys. I won't keep you. Got one more?
Thank you.
Sorry, what's the exact name of your class?
Oh, so it's Adult Health 1, but you're gonna turn around and take an Adult Health 2 as well. Another way of saying that is Med Surg 1
Oh, okay, I
Yeah.
thought you were taking mid-surg.
and Med Surg 2. Just depending on what school you go to, they call it either Med Surg or Adult Health.
I'm sorry, I have one more question.
Go ahead.
I believe, were you in ADON?
Yeah.
Okay, I was just making sure, because when I first came in, we did the orientation, I remember they were in ADON.
Yeah. I was a teacher pretending to be an ADON. Not getting nearly enough time with the students, and it was frustrating, so I had to fix that.
It was nice meeting you.
Nice
Thank
meeting you.
you.
Hi, see you.
Thank you.
Okay. Just a couple of other things I want to make sure that you guys have. As I say, you've got this big list that we sort of went over a little bit. Remember, mydriatics have a D in them, right? So what do you think they do?
Dilate.
Dilate, yes, okay. Again, osteoporosis meds. Now, we all know that Actonol is a biphosphonate and it's recitronate. Thank you, whoever put those pieces together for me. I appreciate that. Remember, I think there's another one. It's not on this list, but it was, I think, on your other HESI. It was called FOSLO. PHOS-LO, FOSLO. It's on page 837 or 836, somewhere around there. And it's in the section about vitamins. It binds to phosphorus. It's for the renal patients. These renal patients, their phosphorus gets too high. So think like Kayexalate, where that binds to potassium, right? Remember Kayexalate? Because that's on that list somewhere, isn't it? Kayexalate somewhere. I promise you it's on that list. But anyway, FOSLO, here it is, Kayexalate. So think about Kayexalate, evaluating the renal patient with that. Again, FOSLO, their phosphorus is too high. FOSLO binds it and helps bring the phosphorus down. But Kayexalate, you know, that's for potassium that's too high, isn't it? Okay.
So with FOSLO, it's asking for the patient teaching.
Hello?
It's for what though?
With FOSLO, it's asking for patient teaching. So
Okay, excellent.
Patient teaching, making sure maybe they don't eat foods that are high in phosphorus. So that's why on that page, what does it say about FOSLO? Does it say anything about FOSLO? It is a form of calcium.
I think she was telling you on the HESI, it's asking for patient teaching.
Correct. It will ask for patient teaching. So it might ask something like making sure they're staying away from certain foods that are high in phosphorus. So on that section in vitamins where it's under calcium, it might be talking about that. Making sure that they're not eating foods that are high in things like phosphorus. It is a form of calcium. So it might help to bring that down too. They might not need to be eating foods that are high in calcium.
okay.
Let's see if there's anything else. Gosh, there's so much. I'm trying to make sure I give you as much as I can possibly think of regarding all of this stuff. I think that's pretty much the list, right? That's pretty much the list. But these are the things that I wanted to just delve in a little deeper, just to help you a little bit. All of it is going to be patient teaching. I would say predominantly. Jordan, you've done it, so what do you think? Is it patient teaching?
Yes, a lot of patient teaching.
A lot of patient teaching to do with making sure they take the meds at the right time.
Well, it's usually not to eat while taking certain medications, stuff like that.
Okay, so remember with warfarin, what types of foods would you not eat with warfarin?
Dark green,
Leafy green vegetables, right? Yeah. Will interact with that. It will make clotting, so we don't want that to happen, right? That's the whole point of being on warfarin. So bear in mind those types of things. St. John's wort, usually it'll be a question to do with the interactions of something with St. John's wort. Okay. What do people take St. John's wort for? A lot of the time for depression, right? Depression and anxiety. So again, think of those medicines that might be an antidepressant or an anti-anxiety med, and they're taking St. John's wort as well. And that could make the medication be too effective and end up with serotonin syndrome, something like that. So again, unfortunately, I don't know what they're actually going to ask about. Make sure you know these, the peak and trough.
Oh, yeah.
Okay. And I think that's pretty much all I can think of off the top of my head. But I would suggest you go through this list with a fine-tooth comb. If you want to do note cards, something like that, and test each other. But a lot of what you want to know are patient teaching, side effects, maybe lab values, things of that nature. You know what gout medications would be? Remember I said allopurinol? Allopurinol is a gout medication.
What day and what time did you say our test?
Oh, I didn't. So, HESI final, yeah, gosh, I'll put a note on the announcement. Make sure all of you register, all right? Make sure you've all got that set up and register, because as you know, there's nothing more stressful than one, you being the person that hasn't got it together and everybody's waiting on you. And of course, it's stressful for everybody else. So what we will be doing is meeting in the computer rooms. Actually, I'll try and meet here. We'll meet in here, and then we'll go down to the 2 computer labs, okay? And we'll be so. And that'll be Wednesday, because you don't have enough. But I'll see you tomorrow. I'll be here tomorrow anyway.
And we're coming in at 8 again tomorrow?
Yes.
We're gonna take our quiz first, right?
Yes, you'll take the quiz. Miss Villabona will give me the code.
What about those in celebration? Do they not get to take the quiz? Or we will?
Everybody is going to take the quiz first between 8 and 9, and then we will split. The people that are going to go to sim will go to sim, and the people that are going to come with myself, and I think maybe Miss Villabona might be on the teams with you guys, but we'll be doing that. She is going to set up a discussion post area so that you can all upload your, your PowerPoints and things, and also the surveys. And the reason that we'll need that is to prove, instead of you having to be here for 12 hours, it's a 6-hour day because it's a sim day. So that's the way of proving it, okay? All right. Any other questions?
And what time did you say that the test was on Wednesday?
I didn't. But it will be come at, for 12 o'clock, usual time. Yeah. Because do you have your funds final? You've got your funds, I see that day?
No, we do it Friday.
Oh, you got it Friday. Okay, so yes, 12 o'clock, be here like normal. We'll do the exam and then.
Where?
So 12 o'clock Wednesday?
Yeah.
Okay.
Yeah, 12 o'clock Wednesday class. Yep. You'll do the HESI. And then that'll be it.
So do we have class with you Monday? Are we doing
No,
something?
that's why I
We do
was,
for fun.
that's why I wanted to
This is
go over, yeah. This is why I was trying to get as much to you as possible. And as I say, I really don't think you're gonna have anything on chemo in the sense of the chemo drug. I just really don't think that would be the case. Did you see any chemo drugs? You won't remember, but I really don't think so. And if you do, it would say this is a chemo drug. And it would ask you about the side effects or patient teaching or something like that, okay? But the big things, Neupogen and Epogen are always on the HESIs. And, all right? Yeah?
I think you've done a fine job, Ms. Fletcher.
I've
Thank you
tried.
for everything.
I've tried. You're gonna love.
You are a great teacher. Don't let nobody tell you
Yes. Period, we appreciate it.
Well,
Honestly.
you're gonna love Professor Davis. Now, he's more, hands-on visual. I'm more of a throw information at you. Yes. Epogen. So, see, I put it in alphabetical, so here's Epogen. Yeah. And I put it here like, Filgastrin is the other one.
Okay.
Okay, Filgastrin is Neupogen. I know, I put it in, it's all in alphabetical. You're welcome. All right, let me, and this is recorded. Thank you for your patience. Do you need the codes to clock out, guys, or do you have it?
I have it.
Okay, and Ashley, do you have it too? Okay, I think she does.
So, as far as arrangements as for making up the quiz and exams, do I speak with you after
I
Hesse?
think, yeah, I think what's going to happen from what I'm understanding is it's going to have to happen in break week.
It's not gonna be all in one day, will it?
I don't know how it's going to happen. Honestly, Decretia, that's not up to me.
Okay,
You know, but the bottom line is it will be, and from what I'm understanding, anyone who's not going to be able to finish out the term properly is going to have to do it in break week. So that's how I understand it will be. Whether it will be all in one day, I don't know how they're going to set that up.
okay.
All right.
All
Was
right,
this
thank
helpful? At least you've got the information so
Yes,
that
ma'am.
you can start, you know, digging in and studying and
Okay,
prepping. Make sure you all get your remediation done though, from
okay.
the practice one, okay?
Now, one more question with the remediation. Say, for instance, I do not achieve the 100%. Is there something that I do, or just it
That's
is what it
fine.
is?
Just at this stage, excuse me, at this stage, I just want you to do the packets. I would suggest if you don't get 100%, do the essential and the recommended.
Okay,
Okay?
alrighty. Thank you so
All right.
much.
You're welcome. Just FYI, guys, I'm going to put a note up on announcements. Make sure you do the essential packets. But as Decretia just reminded me, if you don't get 100% on the essential packets, you only have to do the essential. If you don't get the 100%, then do the recommended.
100%.
If you don't get 100% on the essential packets, your remediation, this is remediation.
I'm done with mine, but I don't know.
Okay, I'll have a look.
It just said done.
Personally, I would suggest you do all of them, but
But all we gotta do is the essentials.
the essentials have to be done. The essentials have to be done, okay?
I gotta answer a question. On our grade top,
Yes.
we have something right here called dosage, lab dosage assessment 1. I got an 8 out of 10, but some people said that was something we didn't have to do.
You didn't have to do it. Yeah, that was, oh, let me just stop this recording. Some people did it and it was